We're going to move now on to objective data assessment in the plan. Those three items we collect on the oral health tracking sheet, and I'll refer to that as the tracking sheet. Elements of management on the tracking sheet: the date, the eruption periods, the salivary pH, the gingival bleeding index, decayed, missing, and filled teeth and surfaces, the debris index, the calculus index, the oral health index, brushing and flossing instructions, caries risk, periodontal condition, photographs, caries risk test, and salivary flow. I will refer to this as the CRT throughout the remainder of the presentation, so that'll stand for the caries risk test. 100% xylitol chewing gum products, the xylitol product recommendations, fluoride recommendations, antimicrobial recommendations, nutritional information, treat the cavities, follow-up treatment date, and referral. We're going to go through each one of these individually, whose responsibility is in the office to collect that data and how they collect it. What you see here, we call on this slide the Cavity Stoppers Oral Health Tracking Sheet. In your manual, you'll have a tracking sheet that's similar to this, but may not exactly be the same. Objective data collected by the staff. We want the staff to collect the following data: the date that the procedure was performed, the pH, the gingival bleeding index, the debris and calculus index, oral hygiene index, which is just a combination of the plaque index and the calculus index. And we want them to check whether or not the prophy was done that day, and then to evaluate the extracted or filled teeth. Staff responsibilities: assess and record eruption period, pH, salivary flow, gingival bleeding index, debris index, calculus index, calculate oral hygiene index, and check whether brushing and flossing was performed. We feel that eruption periods are an important period to prevent dental decay, and we believe that children are more susceptible to decay during the eruption of teeth. Period 1 is the eruption of the first to the last primary tooth, 6 months to 36 months of age. Period 2 is a dormant period of eruption, and period 3 is the loosening of the primary central incisors, or the first sign of the permanent first molars, until the eruption of the maxillary lateral incisors, ages 5 through 6, 8 through 9 in boys. Period 3, here's a slide that just shows what period 3 looks like. We've got central incisors coming in the maxilla, and we have 2 lower central permanent incisors on the mandible. Period 4 is a dormant period of eruption, usually between 8 and 9 and 10 to 12. Period 5 is the loosening of the primary molars, or the loosening of the lower primary canines and the eruption of the second permanent molars, ages 10 to 12 or 14 to 16 years of age. And period 6 is the dormant period of eruption, except for third molars, 14 to 16 years of age and beyond. Here's a slide depicting period 5. You'll notice on the mandible that we have a permanent cuspid coming in on the left side. Salivary pH. In our office, the first thing that when the child comes back, we have a little litmus paper, and you can see a picture there on the slide. We take a 1 inch to 1.5 inch piece of litmus paper, leave it there for about 10 seconds, and we wait for a few seconds to see what the reading is, and we record that on the tracking sheet. pH level of less than or equal to 6.8 is a cause for some clinical concern if the history is negative. In other words, if we're seeing that mom and dad has had cavities, that would be a negative history. A pH level of less than 6.2 is a cause for more concern and needs your attention. Questions that we ask ourselves at this point: do they have a dry mouth, or are they taking meds that can cause dry mouth? Dry mouth makes a child more susceptible, or a patient more susceptible, to dental decay. Gingival bleeding index, or the GBI. We use a simplified technique, and usually it's done with floss, although you could use a triangular interdental cleaner if you felt that was more appropriate for your office. The way that we take the GBI is that we check between the following areas for the primary dentition. And it's simply take a piece of floss and floss between the tooth numbers A and B, tooth E and F, tooth numbers K and L, and tooth O and P. There's a total possible score, if all areas showed gingival bleeding, of 8. And again, this is just done with floss. It only takes about 15 seconds to quickly go through those areas. The GBI for the transitional dentition, we use the areas between tooth number 3 and A, 8 and 9, or the most distal contact between two teeth if 8 and 9 aren't present. Tooth numbers 19 and K, and tooth numbers 24 and 25 are again the most distal contact between the first two teeth that you come to. Again, a possible score of 8. The GBI for permanent teeth, we check between the following areas, counting each interproximal area as 2. Tooth numbers 2 and 3, tooth numbers 8 and 9, 13 and 14, numbers 18 and 19, 24 to 25, 29 to 30, possible score of 12. Remember, this can quickly be done with floss. You'll wait about 30 seconds after you floss the teeth and then just go in and see if there's any gingival bleeding in those areas. Here's an example of a GBI, and we'll count this as 2. This is on an adult patient, and if you'll see there, we've got hemorrhage between tooth numbers 19 and 20. Your staff member would count that as a 2. Here's again an upper anterior incisors. We've got some gingival bleeding. We'll count that as 2. Occasionally in GBI scores, staff member will indicate that there's no gingival bleeding, although when you come over to do the exam, you'll notice after the prophy that you have bleeding, general bleeding throughout the mouth or puffy gums after the cleaning. This is where you have to step in and say, even though the GBI is recorded as 0, it's quite evident that there is some gingival infection and disease taking place. We'll next discuss the debris index.